Hello and welcome to Health Matters. I am Mary Alale Yusuf. Leprosy is a chronic ailment which affects the skin, among other things. The prevalence rate has dropped from 21.1 per 10,000 people to less than 1 per 10,000 people. This drop meets the demands of the resolution passed by the World Health Assembly in 1999. Yet areas of endemicity are still present in several countries, and Nigeria is one of them. The documented prevalence of leprosy from 115 countries was just over 189,000 people at the close of 2012. In the same year, almost 233,000 new cases were reported. My guest on the show today is Dr. Funmi Ajose. She's a consultant dermatologist with the Lagos State University Teaching Hospital, Ikeja. You're welcome to the show, Dr. Ajose.
Thank you.
Let me start by asking you, what are the symptoms? What does this leprosy look like? How does one know this is a leper?
Oh, of course. everybody knows what a leper, looks like. People have this picture of someone with no toes, no fingers, no toes, picture of a leper. But that is different from someone infected with Mycobacterium leprae,
which is the bacterium that causes the leprosy.
Yes.
Just before you go on, I must correct myself. The demands of the resolution passed by World Health Assembly, they passed that resolution in 1991, not 1999. Forgive me for that mistake. Let's go on.
Yes. We don't use the term leper for people infected with leprosy.
Okay.
The leper terminology is colloquial, is derogatory.
Yes, it does sound
yes,
horrible.
And it's usually attributed to those at the end stage of leprosy infection, and in fact, often those with burnt-out infection, because someone that's freshly infected with leprosy looks just like you and I. And
that is frightening.
Yes, and that is where the problem is, because for too long we've been fed with this wrong picture of the infected, leprosy patient, and that is why most people have closed their eyes and ears towards leprosy, thinking that it cannot happen to me. But if you realize that a freshly infected person looks just like you and I, that you do not really need to come in physical contact with an infected person to get infected.
Oh, just a minute. You don't need to have physical contact to get infected.
You do not.
Let's just take a side journey here and ask, how is it transmitted?
You see, leprosy enters the body through the nose. It is a droplet infection.
Okay.
So anyone who is infected with leprosy just needs to enter this room and sneeze, and millions of bacteria are released into the air, and we will all be contacts of leprosy. But who comes down with the infection is a function of the immunity
of the person. Now, apart from the fact that it's transmitted by droplets, it's sounding curiously like Ebola. That someone can just come, sneeze, and everybody can get it?
But Ebola is not droplets.
Yes, Ebola is not droplets, but it's
that is the saving grace for Ebola, because Ebola is too deadly to be a droplet infection.
Is leprosy not just as deadly?
No. There's a big gulf between Ebola and leprosy, a wide gulf, in that leprosy will not kill you as rapidly as Ebola would kill you. And leprosy can even be self-healing. Not everyone who is infected with leprosy will come down with infection. If you have a very good immunity, leprosy can in fact be self-limiting. That is, you can be infected.
And then it will just pass.
It will just pass if you have good immunity. So leprosy is the quintessential immune dependent infection.
Okay, let me ask, if somebody were to have leprosy and get healed, maybe, it goes out of the body, can that person be immune for life? Is it that type of infection?
No, there is no such thing as lifelong immunity. For the kind of immunity that leprosy is related to is not the kind of immunity that has memory.
Okay.
It's not the kind of immunity that can,
In which case your cells would remember that this thing has come
exactly.
before. It can't come again.
No, yeah. So it is what we call cell-mediated immunity. And it is different from humoral immunity, which is the one that has a recall,
Okay.
that the person can know that, oh, you've come again, But the fact that there's another type of immunity that we call innate immunity, which is resident largely on the skin and the gut. And that is the first contact, that is your first line of defense. And because if you have a very good self-mediated immunity or innate immunity, leprosy can't touch you. And that is why some people believe that leprosy is hereditary, because your kind of immunity can be an inherited attribute. It is possible for you to inherit a very strong immunity, and it is possible for you to inherit a very weak immunity.
Now, you said that leprosy, somebody can have leprosy and look perfectly normal.
Perfectly.
So how long does it take for the leprosy to begin to show as leprosy as people know it from the time of infection?
It depends on what you mean by show. The leprosy can smother on for years, and it will be, you will know you have, it is possible to diagnose. Let me get this clear now. It is possible to diagnose leprosy very early, very, very early, maybe within, depending on the level of immunity. If the person has a suboptimal immunity that cannot completely ward off leprosy, that person will manifest some signs and symptoms that the experienced, the educated health worker or educated layperson will be able to recognize. But that person will not be, what shall I say, will not be decompensated. That is, the person will not have amputated fingers and toes. They will not have, the signs that you attribute to leprosy will not be present.
Like what we just saw, you were not looking, but
Yes.
it's like the fingers were chopped off.
Yes. You see, they should stop showing that kind of picture.
Okay,
for
maybe at this
leprosy.
point, I should ask you, what are the signs and symptoms?
Yes, let us proceed. Now, I've just told you that leprosy is a droplet infection. The person who is transmitting this is sneezing. So obviously, the first place to look will be the nostrils.
Okay.
Okay? But it isn't often diagnosed at that stage.
Oh, definitely.
If you ask a lot of ENT specialists, that is the doctors
Yes.
that are in
Ear,
charge
nose,
of
and throat.
ear, nose, and throat, how many leprosy cases they have diagnosed in their career? Close to zero. Because the awareness is poor of the fact that somebody comes complaining of irritation around their nose, non-specific irritation, dryness of the nostrils, especially during the harmattan. During this past harmattan, the person with leprosy, early leprosy, we have unusual dryness of the nostrils. They will feel tingling in the nostrils. They will not be able to understand what is going on.
But couldn't that be confused with something else?
That is the reason. That is the reason why it is ignored. Because like many signs of early leprosy can be confused with many things else. You just have to have a high index of suspicion. You have to have a high index of suspicion and keep a tag on such a person. that somebody says, I'm always, fiddling with my nose. It's always like there's an ant in my nose somewhere, and it is very dry, and, and they're always doing this and doing that. And if they do, sniff for too long, they have bloody discharge.
I would assume that such a person would be treated for something else for
Precisely.
some time at least.
Yes, that's what happens. They keep treating them. In the end, they just say, go and buy Vaseline and be rubbing in your nostril, or go and buy shea butter and be rubbing in your nostrils. So that will now pass. That will go on for a long time. And if it goes on long enough, you may find that the bridge of the nose may collapse. This cartilage in the nose may actually just cave in.
Okay, so the nose goes down.
Yes, so you have this compression in the nose. And maybe when that happens, maybe the ENT surgeon will now be saying, maybe we should look at the rest of the body. Okay, but if you find someone with non-specific dryness and tingling and, that persists for a long time, it's not something that just, comes for 1 week and disappears, But if it is persistent, you should look further, you should ask questions. And then the other thing is the person starts to have a nasal speech. You start to notice that the speech changes into a nasal kind of speech. And in ENT, they should follow such a person.
Is that because it affects the vocal cords?
No, because of the nerves that, because it's a neural infection. As soon as it enters through the nostril, it goes to the nerves. And all this tingling and abnormal sensation that you're experiencing is because of the affection of the nerves around the nostrils. Now, the next thing, we move from the nostril, which may be missed by the ENT surgeon, and then it goes to the eyes. Because the same nerve that supplies this nasal area also sends a twig to the cornea. So the person starts to have grittiness, as if sand is in the eyes.
And that can also be mistaken for something else.
Exactly. So you see why it is missed all along. So the person starts to have grittiness in the eyes, the production of tears, is reduced. So they have dry eyes. So we have now moved from dry nostrils, irritation around the nostrils, we've got to dry eyes. Okay. Now, but if at that stage, somebody should just look at the rest of the body, you will now find areas of lighter skin.
Oh, there's now depigmentation.
Yes, you find areas of depigmentation. That is, the skin is lighter in patches.
We'll have to take a break at this point.
Okay.
When we come back, we'll take it up from there. Okay. Please stay with us. You will agree with me, this is getting interesting. And then you can comment when we come back from the break.